Wasserman, and I'll give a short presentation waiting for the hook. Okay, basically, the title of my presentation is E-Patient Mobile Healthcare. I'm working mobile health, and I'm going to be focusing on two areas. One is remote mobile health, and that is taking portable medical devices off the shelf and having it sent by wireless or by cell phone to a database on one which could monitor the various indices or records. The next thing is something for a future presentation on mobile devices using mobile phones. The third is the one that I'm going to be focusing on is to facilitate personal health information. And there's a company I'm working with on a personal health network and can exchange information through electronic medical records as Google, Microsoft Health Board, or Dossier. And the personal health network records personal health records presented. If anyone wants a copy of the presentation, which I have is longer, please give me a card. Okay, let's talk about remote monitoring systems. A lot of the focus has been in other areas, but this focuses on wireless or cellular. And the whole idea is to link patients, families, providers using cellular phones or wireless to put information in terms of test results, like diabetes, like glucose, and the other into a database. And RMS, which I call Remote Monitoring Services, maintains a wellness program for healthcare professionals to use. So some of the data could be used for personnel or for physicians or hospitals. And this is what I call patient-connected healthcare, where these on the left-hand side is where you collect information. You transmit it through this device called Health Cloud. You can have more than one device hooked to it. And it transmits it to the server or other services. And get automated alerts, and that goes to report and store. And you can have web access to healthcare professionals, and that's using Microsoft Health Vault or Google or other types of report and storage. This one looks about the value added. What is the impact of mobile health? And that's to reduce healthcare costs, advancements, reduce unnecessary hospitalizations, and cost effective to deploy and maintain. The whole idea is to identify what are the values of using these devices in terms of reducing healthcare costs. The next thing is focusing on the Patient Protection Act of 2010. And this is part of this HRA law, and it's a federal grant programs, provides health IT implementation, and then you have the Patient Protection and Affordable Care Act, and that is using electronic records, telehealth. Telemedicine is another area that's way before mobile health, but that application is still in vogue and still important. Let's look at some of the characteristics of why health records are important. They provide storing and retrieving information. They're solutions to everyday health-related activities, such as recording, delivering lab results, medication, renewals, and record health-related activities. I call this e-patient-centered connected health. And connected health, I think, is the key ingredient to connect the new health technologies and improve communication between providers, patients, and families. And you have the monitoring and tracking patients, where you can set up various constraints, or like on diabetes, sugar levels, you can have measurements that could call alerts to you, or you can track something that's very disturbing in terms of whether sugar levels are going to 300, and you can call your doctor up, or facilities, and provide that information. This is an example of the PHR, looking at the health information exchanges, the personal health applications. And this is where you can store the information and get other information. And it's very robust. You can have reminders, a calendar, messaging, and the bottom is the telemedicine devices. the ones that I've talked about. There's some new ones that I've seen in the CPAC. And this is some of the characteristics of the, what I call personal information and notification on network.
Got it.
And in summary,
Sorry. That's fine.
in summary, I'm going to shift to e-patient. I think there's a shift now to e-patient connected health. The only question is how long it will take to reach this critical mass and how to begin to scale up for payers, providers, and consumers. And talking to the state of Maryland, the whole key is who's going to reimburse for this information to have these remote medical devices or to use patient health records. That I think is a key aspect. I've called up, as I said, people in the state of Maryland and other people from other states that I know are saying hospitals are interested in one thing and one thing only, is how can I get reimbursed. So I look forward to getting your name cards, and I'll be more than happy to send this presentation at a longer level. Thank you.